Nigeria is facing a severe malnutrition crisis with around 11 million children experiencing food poverty, according to UNICEF. Now, this translates to 1 in every 3 children under 5 years old with severe malnutrition, leading to stunted growth, increased susceptibility to diseases, and higher mortality rates. The situation is dire, and this is the reason why Save the Children and other organizations are warning that an additional 1 million children will suffer from acute malnutrition by April next year if urgent action is not taken. And now joining us on the conversation this evening, we have Prosper Dakurah. He is a nutrition manager, UNICEF in Abuja. Thank you so much for joining us on the conversation, Prosper.
Thank you very much. Good afternoon to you and your listeners.
It's a pleasure to have you. Now, to begin with, UNICEF's recent report indicates that 11 million children in Nigeria are experiencing severe child food poverty. Can you explain the criteria that UNICEF uses to define severe child food poverty and also how it impacts children's overall health and development?
Thank you very much, and I'm very happy to be part of this conversation to discuss issues of mutual interest, of course, that affects children in this country. So globally, children's diets are classified under 8 food groups. So for a child to consume optimal diet, a child must consume at least 5 different foods from these 8 food groups. So if a child consumes less from these 8 food groups, then the child is classified as being in food poverty. Now for UNICEF, any child who is unable to access and consume nutritious and diverse food, especially in early childhood, is a very big problem. As you rightly mentioned, it results in stunted growth, it results in wasting, and it could also result in cognitive and other life-threatening conditions. Now, when we talk about child food poverty, a child is said to be under severe food poverty if the child consumes 2 or less of the 8 food groups that have been established. And that is a worrying trend that we are currently observing in Nigeria.
All right, now speaking of Nigeria, we know that Nigeria is among, the 20 countries where the majority of children facing food poverty live. In your experience, what are the main reasons that Nigeria in particular is vulnerable to such a crisis?
Well, I'll say that there are several drivers to food insecurity or child food poverty. And one of the main issues I'll talk about is the issue of high food insecurity. And when I talk about high food insecurity, I would like to bring it down to certain levels. So for example, one of the main issues that people do not access food is because of economic access. So people do not have the economic access to food as a result of high inflation. And we are all very much aware that somewhere last year, for example, food inflation was as much as 40% in Q1 of 2024. And what this does is that it takes away the ability of people to be able to procure or access nutritious foods for their growth and development. Alternatively, people may resort to cheaper and non-healthy diets. The other contributory factor to high food insecurity could be the issue of physical accessibility. And when we talk about physical accessibility, the inability of people to really access the food wherever they are. So for example, you take the northern part of Nigeria, the issues of insurgents, banditry, and insecurity generally limits movement of people to go to their farms to cultivate, harvest, and get access to food. The other issue that also drives, child food poverty in our context is the issue of climate change, So we are all very familiar about drought, disease outbreaks in certain parts of the country affecting plants and animals. So all these are contributory factors that impact the availability and access to food and ultimately leading to child food poverty.
Now, in addition, Prosper, there was a report by UNICEF that actually highlighted, that 4 out of 5 children facing food poverty globally are fed only milk or starchy staples like pap and the rest. So why is there such a limited access to nutrient-dense foods? And also, what is the impact, that the lack of, these dense food has on cognitive and physical development, especially in the critical early years of the life of a child?
So thank you very much. So as a result of poverty and other issues, people resort to coping strategies. And one of the coping mechanisms is to eat what is available or to eat what is less preferred. So basically, in some of those contexts, if people do not have the economic power to access the market, then they may resort to eating cheaper alternatives such as starchy foods and also what is available in their localities such as milk and others. The other issue also has to do with cultural preferences, okay, and the social norms. So we are also very familiar that in certain cultures, people are so dependent on starchy foods as their staples and do not want to make a change. So cultural practices of food, and all that affects the consumption pattern also in the communities, besides the economic reasons that limits access. In terms of impact on cognitive and physical growth, yes, we see that manifesting. And as you have shown rightly from the videos that you were just showing, the main thing you will see is physical development in the children. So you see that the children grow very, very thin, and that is what we call wasting. And wasted children, if nothing is done, are 9 to 12 times more likely to die. Now, such children, children as they grow in body stature and their brains also develop. Unfortunately, they need good nutrition to be able to achieve optimal growth. So if they do not get the optimal diet and nutrients for brain development, then such children grow up retarded. And this affects, their income, earnings in future, their ability to go to school and learn effectively and others.
Oh, well, still talking about, this particular decline, there have actually been a decline, in severe child food poverty in Nigeria, and I'm talking about from 2012, where it was recorded 45% decline to 32% in 2022. Now, the number is actually still concerning, whether there was a decline or not. So why do you think, or what do you think is behind this slow progress?
Well, first of all, the rate of change may not be as we want in the country, but I would like to say congratulations to the country for making such a progress. Because when you look at the data, what it means is that we have done over 10 percentage points, decline, which for me is very, very good. And of course, it is something that we all need to be concerned about. But of course, in terms of the relatively slow speed, in terms of making progress, basically we can limit that or reduce the discussion to suboptimal infant and young child feeding practices. So the behaviors, that our mothers or caregivers adopt in taking care of these children impacts on how the children, turn out to be in future. So whether they are fed optimally and whether they are cared for optimally, affects, contributes significantly to their growth and development. Also, the issues of food taboos and social norms and practices. So we are living in the part of the world where culture dominates all that we do. So in most of these communities, societies, food taboos predominate everything that we do. Also, the social norms and practices also inhibit or prohibit children from eating or accessing healthy and nutritious foods.
Now, some of the factors that I didn't hear you mention and that we know of, that contributes to food insecurity, economic challenges, and also climate change. These are some of the challenges that are fueling the rise in malnutrition. And also, we know that the poorest families are more affected. That is, according to your research, 44%. 44% of the poor families compared to 17% in wealthier families are affected by malnutrition. So all of these, I'm talking about the food insecurity, economic challenges, and climate change, they are interconnected. So how are these, crises contributing to the increase in malnutrition among these young children in Nigeria?
Yes, I'll say that they are highly interrelated or interconnected. And of course, besides the data points that you have shared with us, a recent assessment that was conducted by the World Food Programme and also the Ministry of Agriculture shows that 25 million people in Nigeria are currently food insecure, and they do not know where their next meal is coming from. Additionally, we also know that about 56% of the population is living below the poverty line. So when you put all this together, these are factors that are truly fueling the issues of food insecurity and also driving malnutrition in the country. Now, besides the fact that, the economic challenges that you are talking about, yes, the economic challenges basically limits access to people, to be able to access nutritious and healthy diets. So if people are not able to go to the market and procure what they want, then they will resort to cheaper alternatives. So yes, the factors are really interrelated and interconnected. And for us to be able to make a change, they need to be addressed holistically.
Well, Prosper, earlier you did talk about, wasting. So if you could, for the sake of, those who do not know what wasting is, can you explain what it is and also what the link is between dietary deprivation and wasting?
Okay, so let me put it in very simple terms. When we eat food, obviously it's supposed to manifest in our body. Okay, so when you eat food from morning till evening, of course you are supposed to stay healthy. Either you are maintaining your body shape and size or you increase. Especially in children, the more they eat, we see that they grow plumpier. Now, for children who do not have access to healthy and nutritious diet, instead of growing well, they begin to grow thinner and thinner. And when we talk about thinness, you see that instead of the child putting on additional weight, you see the child growing lean. And when the child grows lean to a certain extent, then we see that the child is wasted. And when a child goes to the clinic or the health facility, they have what we call the mid-upper arm circumference measurement. And when they take the measurement of the child, so the arm of the child is supposed to measure a certain, so if the child, for example, is above 12.5, we say that the child is healthy. For most of children who are severely wasted, it goes as low as 11.5 and below. And that is very, very serious. Such children, if nothing is done, they die. And that is why for us, it is a very critical area of intervention.
So let's look at, another...
In terms of dietary deprivation, yes. So if the child is deprived of healthy and nutritious diets, it obviously results in wasting. And that is something that you see more and more in the northern part of the country, especially where there's a lot of conflict, war, banditry.
Yeah, we'll actually talk about that, some more, talking about, the northeastern part and also conflicts and everything. But now let's look at, another growing concern, and that's the role of marketing cheap, unhealthy, ultra-processed foods. We want to see what this actually plays, the role that this actually plays when it comes to marketing this food for the children. So what is UNICEF's stance, on regulating these kind of foods that are marketed to these young children in Nigeria?
So thank you very much. So the regulatory function lies with the government, so the state and federal authorities. So for us, UNICEF, what we do is to support government in putting in place the necessary legal or regulatory frameworks. So we work very closely with NAFDAC, we work closely with the standards authorities, we work very closely with the Federal Ministry of Health and other partners to work on instituting laws, regulations that prohibit the production, marketing, and sale of unhealthy and unwholesome ultra-processed foods, especially for children. And that is something that we have done successfully, especially on the marketing of breast milk substitutes. Beyond the marketing of breast milk substitutes, we are also working with state actors in shaping the market to ensure that manufacturers are very conscious of what they produce and to ensure that they contribute to the production of healthy and nutritious foods for children and for the entire population.
So the number of children suffering from malnutrition rose by 51% in northern Nigeria. We're going back to northern Nigeria now. And this is with over 208,000 treated in 2023 alone, not to talk of, 2024 and all that. So how does UNICEF collaborate with local and international partners to address this particular issue, especially at the community level?
Thank you very much. So the issue in the northern part of Nigeria is very worrying, and I'm happy that you are bringing this aspect to the discussion as well. And the statistics that you have mentioned, maybe I'll share with you more recent data. So from the recent analysis that we have done, we anticipate that in 2025, about 5 million children will be acutely malnourished. And out of this 5 million plus, we are talking about 1.7 being severely wasted. And this 1.7 million children, if nothing is done, these children are at a higher risk of death. Now, UNICEF and partners have been intervening in the northern part of the country for some time now. And last year, working with partners, community actors, state actors, federal actors, we were able to treat almost 1 million children across the humanitarian states in the northern part of the country, which is significant. So what this simply means is that we were able to save the lives of about 1 million children in the northern part of the country. Working with community actors is something that we have been doing, of course, civil society organizations at the grassroots level, mother-to-mother support groups, community volunteers, to be able to identify as part of early detection, of severely malnourished children, and also to scale up preventive nutrition interventions in the communities. So we'll be working with them and we'll continue to work with them. We'll also be working very closely with development partners in those areas, both local and international NGOs, to be able to meet the increasing needs in the northern part of the country and the country at large.
Prosper, are there any key areas, where we could actually do better? I mean, you did say that recent data, 2024, or recent data projects or predicts that 5 million children will be at risk of acute wasting. That was what you said. So where can we do better? How can we do better?
So basically, we need to put in place a lot of measures to be able to address this. And one of the things that I'll talk about is for us to work holistically as a country to prevent the occurrence of that, okay? And when I talk about working to, to prevent that from occurring, is putting in place systems, measures, and structures to be able to address that. So first of all, we need to look at how we can ensure that peace prevails in the northern part of the country. That is very, very important. Where there is peace, people will be able to access their farms, people will be able to cultivate food, and people will be able to access nutritious and healthy diets. So that is in terms of addressing the humanitarian aspect of the issues there. The other part is also to transform the food systems, okay? Now, the food system basically talks about what people produce and what people eat. So how can we ensure that people cultivate nutritious and healthy diets? And this comes with educating the population on what is healthy and what needs to be produced and eaten. We have to stop the issue of, going and eating a lot of foods that are ultra-processed. That doesn't help us as a country. The other part, of course, is to strengthen the health delivery system, okay? The health delivery, so most of these essential nutrition services or interventions are implemented through the health system. We need to be able to build capacity across board to be able to deliver and to be able to support the delivery of services at all levels in the country.
Yeah, most especially in the underserved areas, right? The underserved and rural areas.
And exactly. And we also know that we have poorest of the poor. So, of course, when you look, just like you mentioned earlier on, we have the poor and the rich, and we also have those who are in between. So for those who are very poor, how can the system support them to be to also live healthy lives, okay? So we're talking about social protection systems. So how can we expand the social protection system to ensure that we cater for the needs of the most vulnerable people in our societies? And of course, the last but not the least is also to have a robust data system that is able to identify children and also households or families in crisis, and to be able to address their needs before it becomes worse.
All right, Prosper, we're still staying in, the northern region, especially northeastern regions, where we know that, there's conflict, displacement, and the likes. We also know that healthcare facilities are often non-operational in those places. So what other challenges is UNICEF facing in reaching children, in these areas, especially with nutrition programs? Essential nutrition programs?
Thank you very much. So UNICEF is a key partner to the government and the states. And in nutrition, we usually say that UNICEF is the cluster lead and also the provider of last resort. So we wouldn't say that because there is conflict or there is insecurity, UNICEF will not operate there. So we have boots on ground. So in all those areas that you have mentioned, we have field officers, we have staff who are operating there, delivering integrated services across health, nutrition, wash, child protection, etc. So we have very strong field presence. working hand in hand with state authorities and also development partners to be able to reach and to ensure that children who are in those circumstances are reached with essential services, and to ensure that they also benefit and also actualize whatever is due them as children.
But does this also, apply to therapeutic foods, for malnourished children? Because we know that these kind of foods are actually in short supply, not just in Nigeria, but globally.
Yes, so for the nutrition portfolio, let me speak more on that. So for the nutrition portfolio, we deliver a set of preventive services. So basically, although we are talking about humanitarian situation, for us as UNICEF, the priority is to prevent malnutrition from occurring. So we provide, for example, micronutrient supplementation, where we give vitamin A supplementation to children. We give multiple micronutrient supplements to pregnant women. And we also provide what we call small quantity lipid nutrient supplements to children to ensure that they grow and then they thrive. For children who become malnourished, severely malnourished, then that is where we intervene using the ready-to-use therapeutic food, which we call the RUTF, which is really a game changer in the management of severe wasting. So RUTF, thanks to our partners and collaborators, we are able to provide and to support the treatment program going on in the country. You've mentioned it rightly. Resources are very, very scarce. The competition is very, tough globally. A lot of competition for scarce resources from our donors. But thankfully, they've been able to support us in the past, and we hope that you will continue to support us to deliver these life-saving services to children of Nigeria.
Well, UNICEF has also called for transformation in food systems and also stronger social safety nets for families. And this is not the first time that this call has been made. They also talked about, social protection programs. So I'm actually asking, can social protection programs like cash transfers or food vouchers, can they alleviate the challenges that these poor families are facing?
Obviously, yes. So, in the earlier part of our conversation, when we're talking about the drivers or the issues, we talk about economic access. So economic access is one of the drivers of malnutrition. So there are people who cannot access the market because they are poor. So assuming that a mother has money, it's possible that she will surely go to the market and buy food and come and prepare for her children. If she doesn't have the money, then that is where she has to apply coping mechanisms, where we talk about the consumption of starchy foods and also dependence on milk. So economic access makes a lot of difference. On the other hand, some of the women also live very far away from the health facilities, and they need to come to those health facilities to access care. If they don't have money, then of course they may not take the children to access health services. But if the woman has money, it's possible that the woman can take part of it, take a taxi or take a vehicle, go to the nearest health facility with a sick child and access services. So yes, social protection through cash transfer or cash and vouchers makes a whole difference in nutrition. And we encourage that and its expansion in the country.
All right, well, just before we go, Prosper, we also are aware that the Child Nutrition Fund, that's the CNF, is actually an important initiative to fight malnutrition in the world. Now, from what we know, it has received commitments from 13 Nigerian states, that's within Nigeria. How impactful has this initiative been, and what more can be done to scale it nationally, to make it bigger?
Thank you very much. The Child Nutrition Fund is actually a game changer in Nigeria, and I'll commend the 13 states that you have mentioned for committing and releasing resources for children in those states. So what a Child Nutrition Fund basically does is that it's a one-to-one match fund. So what it means is that if a state releases $1, UNICEF and Partners match the $1 with another dollar to make it $2. So what it means is that you bring $1, you get additional dollar. And that for us is a game changer in unlocking funding for nutrition programming in the country. So for the states that you have mentioned, yes, a number of them have subscribed to it, they have put money, and they have received their commodities. And that for us is the way to go as a country. We cannot continue to depend on donor partners alone. They cannot do all, but of course, the country also can put in the little that it has. Then with the support of this Child Nutrition Fund, we can unlock more resources to be able to address the increasing need in the country. And I must say that the Child Nutrition Fund is open to all states in the country. It's not only limited to the 6 humanitarian states. So all 36 states, including the FCT, qualify to access the Child Nutrition Fund. And our doors are widely open to engage and to ensure that states are able to access this funding for nutrition programming in the country.
Absolutely. So let's quickly have your final thoughts just before we wrap up.
So I just want to say a very big thank you for having me on this show and having this conversation with you, and to say a very big thank you to the government of Nigeria and our collaborators, the Federal Ministry of Health, the State Primary Health Care Authority, and all the partners that we are working with. Together, we have achieved incredible results in 2024, and we hope that working with you will achieve more and impactful results for children in 2025. Thank you, and I would like to encourage you to have this conversation on nutrition so that we can win more souls to be able to address these issues that we are facing in the country. Thank you very much for having me on this show.
Well, thank you so much for stopping by, Prosper Dakurah, Nutrition Manager, UNICEF Abuja. Thank you.